Hi, Scott Mears here, Global Field Marketing Manager at Rownby. We're here at PSIP, a great pharma event in Basel, Switzerland, enjoying day two, actually the day that we spoke at, and it's been a fantastic day so far. And I've just had a great conversation with Allan here, and we're really excited to have a quick interview and see where Allan's mind is in the industry right now.
I appreciate that. I'm Allan Klinge with Klinge Corporation, here focused on ocean freight in particular as relates to the pharma logistics.
Fantastic. Thank you very much, Allan. And the first question I want to get into is, what's one thing that you feel people really struggle with in pharma supply chain today?
I think certainly we've seen over the last few years a big struggle in certain temperature profiles that have been introduced, in particular with regard to the COVID-19 vaccine. And it's something that we have been working very hard to help our partners with.
Absolutely. And what's one thing that surprises you still in pharma supply chain today?
I'm still surprised by the fact that folks are working toward trust in the logistics supply chain, meaning that they don't want to let anything out of their sight for any amount of time. And I'm very excited about the fact that there's visibility options coming through, both from different monitoring and tracking options, as well as assistance along the way in the supply chain.
Absolutely. And this is a question I always like to ask is, do companies in pharma need more visibility of their supply chain?
I think they do, and I think this is, if you want to say it, it's the way that you get the nice and warm, fuzzy feeling about your transport. It's the way in which you feel comforted that you know your product is going to go from point A to point B, because you can see it the whole time. It's just like anything else you do, and we mentioned that and talked about that kind of today as well. You track that package all the way from the time you order it to the time it gets to your door. You can follow it on the truck. You know it's coming. And there was a great comment somebody else made today. Is, why would you not do that to pharma? Or that treatment or that medicine is so much more important to you than a pair of socks that you order.
It's so true. Human life is in the hands, and taking control and having a solution for that 80% of the journey. You're very right. It just makes sense and it's logical. And moving forward to the third question is, what's one trend you really have your eye on in the industry right now?
I think right now, and it was the topic of at least 3 or 4 presentations, I think the idea of predictive analytics, of understanding when you might face a problem based on both data and local conditions, was to me something that I feel is very exciting, so that you know and get in front of something before it happens, so that you won't have a temperature excursion, you won't have problems that you're dealing with after the fact.
Absolutely. And final question, probably my favorite question, is what's one thing that really excites you about the future of supply chain pharmacy?
Personally, for me, I'm working in ocean freight, so I'm very excited about the move and the transition from for pharma away from air in all cases and towards ocean. I know that there's always going to be room for both, but we see a real ability of pharma to manage its own floating inventories, to manage much more controlled temperature experiences on the voyage, and also to manage a much lower cost delivery system for their products to the rest of the world. So.
Fantastic. Really good to get your insight on that. Really appreciate Allan coming onto this interview. So really thank you very much for that. And we're going to carry on our conversations after this. And thank you guys for listening in, and we'll be back very soon.